deal with the very root cause of the problem. The craving centers in the brain have to be handled. Adi has to be reduced. And then all improvements are going to improve. That's what we have shown in the stress project. When you reduce the stress, the craving, the leptin, the hormone that is released in the brain is going to get controlled and you get the solution. And very simple solution we have for that is the right nostril breathing called Surya Anulom Vilom Pranayam. Done 27 rounds, 4 times a day, before breakfast, before lunch, before evening dinner, before going to sleep. Will reduce 2 kg of your weight in a month. This is a simple thing with thousands of people have started using that. What is the rationale? When you breathe through the right nostril, the Surya Nadi gets stimulated and starts increasing the catabolic rate. The cells get burnt up in the whole process. That's what we showed by this research, showing that there's an increased metabolic rate of 37% in this dimension. And low back pain and several others, we see. So we have taken up in the United States, obesity control program in USA. And can we do something for slow learners, mental retardation, mentally handicapped children? This is the paper that we published in British Journal of Complementary Medicine, and we have shown that the yoga group shows much better improvement in that. And we started a school here for special children, and many children have become normal in our school. Then our Dr. Shimantak Mani, the pediatrician, she said, why bring the children to reach that mental retardation? Can we prevent? Then she took 900 pregnant women and found out in them about 150 people had intrauterine growth retardation. Started giving yoga to the pregnant women. We started reducing, and not even a single case of mental retardation came in the delivery. All deliveries were natural. She did her PhD. I always say that she is my youngest student because she did her PhD, started at the age of 74, finished at 78 age. And what it is so? When you give deep relaxation, technique by MSRT, to increase the umbilical blood flow, Doppler study. Can we call this as Abhimanyu Yoga? That's what our Mohidi always says. Cancer, the most dreaded we have dealt with, wonderful results have come, and we are continuing this cancer. And what we do here is to strengthen the immune system by using advanced techniques like IRT, QRT, DRT, SMET, pranic energization technique, and advanced 7 techniques to strengthen the immune defense. And then we started doing the research to see whether really it works. Effect of integrated approach of yoga therapy and breast cancer, undergoing radiation, chemotherapy, and surgery. Papers have been published. Then we wanted to see whether really the immune system is going to blossom, and can we deal with metastatic breast cancer, and what happens to the DNA, whether the DNA repair mechanism can be improved. Studies on apoptosis can all be done essentially. And now a big study is going on in MD Anderson Cancer Center. 600 patients of breast cancer in a 3-arm trial are going on. And recently at the initial study, we had a wonderful paper that was published which has become a big news all over the world. Randomized controlled trial of yoga in women with breast cancer undergoing radiotherapy. Journal of Clinical Oncology with an impact factor of 18. And this was published recently in this thing. And this everybody is spending. With that, we have taken up the cancer control program in Singapore. And if you are interested, you can join hands with us. So what, in conclusion, can we do here? What you as the achievers, as the best of the people from all over the country, you can join and send your students to our residential courses. Those of you who can come for BSc, MSc, PhD, you are most welcome. And you are going to bring in this Indian dimension into the whole education system. Or those people who cannot come here and study, they can do that in distance education program mode. Then you can get trained and participate in our SDM, Stop Diabetes Movement. Simple 1-month training we will give you, and you can participate in this complete all India movement that we have taken, Stop Diabetes Movement. And Dr. Nagaratna is heading this movement, and all over the country in different states is going on. You can join hands. You need persons who contribute towards this vital movement, Stop Diabetes Movement, to spread throughout India. Your contributions can be very helpful. Then propagate SMET to make our corporate world free from stress. Can you participate in our ongoing research projects to unravel the hidden wisdom base of our Shastras? You can do that. This is how we have to bring in the Indian wisdom base. The Bharat jo mahan hai, usko hum dikhana hai. We need a young person and others. And this is the Prashanti Kutiram. You can go to our website, svasa.org, to get the full picture. Thank you all very much for your nice thing.